I'm a Sila resident. So I grew up in Cudahy. I went to school there. So this is, again, the work that we're doing is very close to my heart, as well as many of you. So again, as Ultimate, we are the largest federally qualified health center. We have clinics both in LA and Orange County. And again, just from humble beginnings from El Barrio Free Clinic, which was in the era of the civil rights in the 1960s. And today we continue that legacy by advocating for and with our patients, with our communities to address social determinants of health. So everything that affects every aspect in our lives. Next slide, please. So, and this is us continuing that legacy through our integrated civic engagement program, which is My Vote, My Health, Mi Voto, Mi Salud. And in this one, we've implemented successfully different community engagements, integrated voter engagement campaigns. It's through our replicable and validated 5-touch civic engagement model. I'm pretty sure some of you have been aware because we've presented here before in past campaigns as well. But what we're also basing ourselves under this model is that we're utilizing clinics as hubs for issue advocacy, education, advancement in social and racial justice. And it's with the foundation of community health centers being the trusted messengers in the community, just like you are as well in your communities, in your organization. So that's what we're basing ourselves on that. Next slide, please. Oh, wait, before I forget, we're also with My Vote, My Health, and I apologize, I'm very excited to share this information. We also have My Vote, My Health, a newsletter if you would like to sign up as well, or you could just see our materials. It's myvotemyhealth.org. And you learn a little bit more about us as well. All right, now next slide. Thank you. And I'm going to turn it over to my colleague, Rosa, who's going to explain a little bit about community advocacy and engagement.
Yeah, so our community advocacy and engagement model and this ties back to our integrated civic engagement model, but it goes beyond just voter engagement and extends into a continuum of engagement that builds power in communities and creates systemic and structural changes that really get at the root of health disparities that Ultimate has been trying so hard to address through strategies like community outreach, education on social determinants of health, leadership and development strategies, trainings, and community-based participatory research, so actually training community members on how to do research on the same issues that we're trying to address, so that they can be partners rather than just, patients and just like people who are part of these systems that obviously aren't working for them. We can go ahead and move into the next slide. Can you hear me? Yeah, okay.
Yeah.
I think, is the PowerPoint working okay? We can go ahead and move into the next, yeah. So now I'm actually gonna pass it over. For this survey, we partnered with Great Public Schools Now, which is an organization that, they are doing a lot of really great work around ensuring that education works for everyone, and especially around COVID and recovery. So I'll actually pass it over to Ana Teresa.
Thank you. Sorry, I was having that issue with my mute. Well, good afternoon, everyone, and thank you for holding space on these important topics, and excited to share a little bit about a report that we released earlier this spring, and then also we are very excited to be collaborating with Ultimed on the report that they are going to be presenting on today as well, that will provide more insights on the impact of COVID-19 on the Southeast Los Angeles communities. Go to the next slide, please. Well, that's transitioning. I'll just say a little bit about Great Public Schools Now. We are a nonprofit grant-making entity. We have a collective action initiative very similar to this My Community, My Health coalition that you guys have. Ours is focused on improving education within LAUSD. And so we have 3 components to that initiative. The first is our grant making. So we are a funder of advocacy and communication grants to community-based organizations. Second, we convene a group. Right now, because of COVID, it happens that we get to do it very often, thanks to Zoom. So we meet every Friday at 2 o'clock. And at the end, I know my colleague Ray is going to share more information about that. And then the third is we do communications that amplify the advocacy that's focused on improving public education outcomes in Los Angeles, or the greater Los Angeles area. And through that, we fund reports and studies, as well as issue some of our own reports and studies to kind of make sure that we are using data to inform our advocacy, and also making sure that community is centered in our advocacy. Just checking in to see if we could get to the slide on the report.
I believe they are working on it, Anna.
Okay, sorry, because I don't have all the findings memorized, so I'm gonna pull up the PowerPoint myself on my computer so that I can have them available. So I think it's a few back. Going back a little bit. Two more. Yeah, one more. Won't be there. Perfect. Okay, so these were the key findings. So what we did was last summer, after LAUSD closed schools during the spring because of the onset of the COVID-19 pandemic, our collective action group worked to get a resolution passed at the LAUSD school board that was authored by board president Kelly Gomez that required public sharing of the data of students logging in and what the academic impacts were of distance learning. And so through that resolution, from last summer through March of this year, we were able to get public data telling us kind of who was logging on, what kind of assessments have been done, and what were the educational impacts to our students. And so we reviewed all of that publicly available data and had a report called Educational Recovery Now, and it called for a comprehensive plan from LAUSD to address these findings. And so, again, sorry, I'm gonna have to go back to trying to find the PowerPoint since it's not on the screen. So the main findings that we saw, sorry. Okay, great. So these were the main findings that we found, which were troubling. And I will note that obviously this data was only for the fall semester of 2020 through the beginning of spring 2021. And the key findings being that about 40% of LAUSD middle and high school students were disengaged or absent from classes in spring 2020. This was important because the district never created a plan from spring into fall to see what they were going to do differently. And so then you saw that as we got to findings about how 2 out of every 3 students are falling behind in literacy and math across the board at LAUSD, there is this kind of correlation between there not being a plan from the spring and into the fall. It's also important to note that the data we have is only for kids who've actually logged on to the district system. LAUSD only requires like a click on Schoology or any of their platforms to count as being on or engaged. So it's not really indicative of whether or not like they're learning while they're on, but nonetheless, like this data only represents the students that have either logged on or have been present. We know that there are thousands of students who've just kind of gone missing over the last year. And so while these findings were stark and concerning, we also want to raise that we believe it's even more stark and more concerning for the kids who have not been able to log on for the last year. I think the other big thing that from these findings that was very concerning to us was this potential graduation crisis that's looming. So in the spring of 2020, LAUSD if in order to graduate, all you need is a D in your A through G courses. So a lot of kids were just given the D to pass, but that didn't necessarily correlate whether or not they actually had the skills to be successful beyond college or career after they left high school. And so what we do know from the data is that there's 40,000 students that are so behind in their credits. That means that they are on the verge or have failed in so many classes over the last year that they won't be able to catch up in their respective to graduate in their respective year. And so that's about 40,000 students. And again, that doesn't include all of those secondary students that we know who've just kind of not shown up for the last year. They're in even a more dire situation. And so we've been really trying to elevate this potential graduation crisis because if the district doesn't come up with a credit recovery plan, or more importantly, help students kind of get those missing skills that they've lost over the last year, and they just pass them so that they can graduate, we're going to basically be passing this buck on to either the community college system or our universities, or leaving kids out of the system altogether because they won't have the skill set to lead opportunity-filled lives. And so these are the major findings of the report. And then on the last slide, these were our recommendations that we made to the district. And we have seen that after this report was published, the district did create the Path to Recovery, which is their plan for how they're going to address recovery. We're also closely monitoring how they're using their recovery funds. So LAUSD is going to receive about $5 billion from state and federal recovery funds. And so now we're just kind of shifting our focus from, we've uplifted the data, we've made some recommendations. Now we want to see the district fully leverage their recovery funds to actually institute policies and practices that will ensure students have a comprehensive recovery, and that's done in an equitable way. The district has typically just kind of given every school the same thing, but as we know, not every community experienced the pandemic the same way. So we've been very vocal about trying to organize around an equitable distribution of funds to ensure that those students and communities that were hardest hit by this pandemic receive the assistance that is adequate to their needs. And so I'll drop in the chat our website so you can learn more about this report, but thankful to have the opportunity to share a little bit about it.
Thank you so much, Ana Teresa. And kind of on the same note, so Altimed launched this survey to measure, the impact of education, but specifically for SELA. And some of you may be wondering, like, why did we focus in on SELA? And I guess we're going to answer that question now. So just as an overview, I mean, all of these organizations here, operate within this community. But, SELA has 440,000 residents. 90% of those people identify as Latinx. And about 40% of them have lower levels of educational attainment and are significantly less likely to have $500 in savings, which is about the amount of money that you would need for a small emergency if something were to happen. And the median income of SELA is about $40,500. And this becomes especially important when you compare SELA to the larger LA County and to California at large. So as you can see, the median family income in SELA is about $28,000 lower than the LA County median family income, and then even lower at $36,000 below that, $1,000 below that for California. And this map on the left, that orange, I don't know how to explain it, that orange color block kind of in the middle of LA, that is the SELA region. And this map measures social vulnerability. So as you can see, this area has kind of been designated by multiple studies to be a highly vulnerable area for things like poverty and lower educational attainment and lower family median income. And when you take all of those things together, you get a community that has been struggling with multiple issues for a really long time, including environmental injustices and lack of opportunity. And now this pandemic, which actually impacted Southeast LA significantly and disproportionately harder than other regions in the county and across the state. In August, Southeast LA was kind of deemed an epicenter for COVID-19 by the LA Times. And this, particularly by different studies and different articles, has been connected to the fact that Southeast LA has a lot of essential workers and a lot of people who work in spaces that are so crowded and have lacked the infrastructure to ensure that families are able to isolate within their own households. And so what you get is a pandemic hitting some of the most socially vulnerable areas the hardest, leading to something like this map, which is all-time case rates by cities and communities. This dark red color block in the middle is actually South and East LA and South LA. And not only did COVID-19 impact these communities by cases and death rates, but we are now seeing a very similar pattern for vaccinations. This same region here that has like the lowest light blue means that these communities are being vaccinated at significantly lower rates, even though they were the hardest hit communities by COVID. And because of that, we chose to, focus our survey on SELA, and I'm going to pass it over now to Cynthia to talk about the survey design and just like how we deployed it.
Perfect. Thank you very much, Rosa. So when we set out to develop the survey and deploy it, this was in January 2021. And in this, we received input from, of course, community partners who reside and provide service here in SELA, but also addressing different issues of like social determinants of health. We asked questions on demographics, of course, most importantly, the impact of COVID on education for SELA families. So our goal was, one, measure that impact with families who had at least one student K through 12, reach 15,000 households, and receive a minimum of 2,000 completed responses. Again, it's to produce this data that we could engage and advocate for our communities and different levels of our communities. Next slide, please. So in this one, which is the deployment of the survey, we set out to find where our communities are at. So we did it in 3 different ways. One was in clinic, as Ultimate having been in the community for over 50 years. So we have our clinics established there as these trusted messengers as well. So we did in clinic with our team, one-on-one survey response completion at Ultimate Medical and Dental in Southgate and Goodrich. We also engaged several of our partners who are here today. So big thank you to them. To engage their participants. Again, they are the trusted messenger, so they helped us with that. And then the third way was in social media, of course, geo-targeting through Facebook and Instagram, our communities in SELA. Next, please. So the in-clinic deployment, and I know we're running a little bit out of time, but I do want to point out that when we were in person, and several of my colleagues had the opportunity to conduct those surveys one-on-one, is where you really receive that very genuine conversation with our parents. For example, there was no hesitation to complete the survey, sharing their concerns, willingness to share the survey with their family and friends. I had one patient said, "This is important. We need to be heard. Like nobody's really looking at in our community." So she was sharing with her, PTA group, all that stuff. So it was pretty a great opportunity to hear that from our patients. And acknowledge the experience of our patients in our community in that. And also we had youth assisting their parents complete the surveys. So middle school and high school students who actually have a different perspective because of their experience regarding distance learning and how COVID has impacted their families and themselves. So we had that perspective, which is great to have. And of course, number one, our Ultimate staff, who majority live in our service areas, actually above 80%. We're engaging, helpful with our team, with the patients, and with themselves as well as completing the survey. So that was just really good outcome as one-on-one. Of course, safety, distance, full PPE, because we are still in a pandemic. Next slide, please.
So now we can move into, the meatier side of this survey, which is the data and findings. Let me see. So for, just an overview of the sample, so we had a total of 5,116 total respondents. Only about 2,542 of those total respondents actually were families living in Southeast LA and with at least one student in K through 12. We got a lot of people who tried to take the survey from outside of the designated area or with students in college and, some adult education, but we really wanted to kind of focus this in on Southeast LA cities and families that had at least one student in K through 12. So the final sample ended up being 2,093 respondents. This is another a breakdown of kind of our sample. And we thought this was important because although, some of these racial breakdowns may not necessarily match the level that CELA is for, Latinx, we definitely felt like it was reflective of just like the diversity and, the vulnerabilities that other racial groups also experience. So about 1,400 of the respondents people of color, and then about 950 were Hispanic or Latinx. Household income was where we feel this is really also a reflection of CELA, where a majority of our respondents were in that $35,000 to $75,000 a year income, like household income. And as you can remember, the median income for CELA is $40,500. So right in between these top two income brackets. And then for household size, we had about 830 respondents report they had more than one student in their household. And then this last pie chart shows the different ways that they were contacted and how these responses came in. And our biggest themes and findings were around definitely race or ethnicity and income as being driving factors for vulnerabilities that made or showed us that students were having a difficult time. So for example, being in those two first income brackets, which is under 35,000 and between 35,000 and 75,000, and being Latinx really changed the game for how vulnerable these students and these families were to being concerned about the psychological well-being of students, about the physical health, about food security, about academic support and social interaction. So our main findings were really around the vulnerabilities that income and ethnicity kind of exposed to COVID and allowed COVID to really just have a deep impact into these families. So for income, we found that a majority of families in those two income brackets were concerned about the quality of education that their students were receiving. We found that a majority of them also saw that grades were worsening. And not only that, but deeper than these educational outcomes, we saw that there's something happening with these families that is leading to these negative or disparate educational outcomes around like how concerned they are for the psychological and physical well-being of their students, and especially around food security. But if you also see on the COVID-19 section at the bottom, these families were also deeply impacted by COVID, through income changes, job losses, and through death and hospitalizations in the family. So how are students supposed to, function through school if COVID is hitting their families disproportionately than the rest of the county? And these families, due to these COVID changes and due to these exacerbated social determinants of health, are seeing higher rates of food insecurity and, just like general well-being. You find these numbers are kind of, these trends kind of continue when you break things down by ethnicity or by whether or not these families were Latinx. 31% of Latinx respondents reported worsening grades. Over 40% report the students were not prepared in core academic subjects like English, writing, math, and science. About 1 in 2 Latino students do not have their own room to do schoolwork in, and Latino parents are significantly more likely to be concerned about the psychological well-being of their students and reporting less social interaction. And as you can see in the bottom, Latinx residents also were disproportionately impacted by COVID through changes of income, job loss, and death and hospitalization in the family. So now to move on to our conclusions. Cynthia?
Yes, thank you. Rosa, I mean, out of all the data, and we are producing a small report and also a one-page infographic that we will be able to share along with more information, so that's more to come. But out of all the data, realistically, we had 3 top lines that we really wanted to highlight is, of course, and you get to here 1, 2, and 3, but one is the income and race, where they're strong predictors of these adverse effects and impacts in our communities, especially under educational attainment, and of course, the physical and psychological well-being. There's also a lack of existing community-based data in our community that we really need, that reflects and helps with the recovery of SELA and other communities like it, so lookalike communities. And number 3 is we need increased funding and research to evaluate the full extent of the impact of COVID in our communities and communities that look alike. So these are the top 3 that we really want to focus on and to promote as well, that we gathered from our survey and our findings.
Yeah, so I think our main takeaway here and our conclusion was that pre-existing social determinants of health and pre-existing social vulnerabilities that existed in SELA were exacerbated significantly by COVID-19. And this is what led to these disparate outcomes in education that we are now seeing. But in order to really measure how COVID impacted SELA and how COVID has reshaped the social vulnerabilities that everyone here has been working to kind of address within that community, we need to ensure that our communities are trained and are activated in their own advocacy, because the only way that we are going to get the funds necessary to really recover communities like SELA is if these communities are activated as partners in order to really advocate for themselves in order to bring this money and these recovery solutions to their community. And it shouldn't be from the top down, because we know that blanket solutions don't work. As we can see through vaccinations, what really needs to happen is that communities like SELA and SELA specifically need to be trained on how to rise up and advocate for themselves. But also, as organizations operating in this area, we need to ensure that all of our interventions are community led and community informed. And with that comes our recommendations. Let me go back. So our recommendations and call to actions, if there are any community members here, we definitely want to highlight our leadership training opportunities as part of our continuum of engagement that we highlighted in the beginning. We have a leadership advocacy leadership academy, a community organizing institute, and a youth community action program, all of which are seeking to activate different aspects of the communities that we serve at AltaMed for different reasons, all with the hope of addressing social determinants of health. And also, we directly want to make a call to action to use the report that we will be later releasing to advocate for families and students in SELA, because we think that, especially like LAUSD and other school systems and school educational infrastructure have to focus in on these communities that were deeply impacted by COVID, and they have to find solutions that work for these communities, not just blanket solutions for the whole state or for the whole county. And then for school and education systems, utilize these survey findings to advocate for students. And I mean, all of you are here now. So for partners, it's really about joining these collaborative efforts and about centering communities in all of your initiatives as we try to move forward into recovery. As our last little thing, we want to invite Ray from GPSN to talk about the GPSN Collective Action Initiative, because I think that's an important thing to highlight during our call to action.
Thank you so much. Well, good to see so many faces and good to meet so many new folks. My name is Ray Lopez Chang. I currently serve at Great Public Schools now. I'm a colleague of Ana Teresa's. So as Ana Teresa mentioned, obviously there's really stark realities that we're facing as a community, not just in the education space, but also in the health justice space, as well as several other sectors. Our goal with the Collective Action Group is we bring together, we're now at about 40 organizations, and we meet on a weekly basis every single Friday to have these really real conversations with one another, to democratize information, and to have these important conversations around how we can work with one another to build a bridge to support our education sector and vice versa. So I just wanted to be brief in my comments and express to you that there is an open invitation to you all. If you are interested in joining our Collective Action Group, please do reach out to me, even if it's to set up a one-on-one, if you'd like to learn more around the work that we do, or being able to join the meeting to kind of get a better sense of what these meetings look like, that invitation is open to you all. And so we invite you to join our efforts. I'll make sure to drop my email and contact information in the chat. But with that, I'll also share my information with Cynthia and the rest of the Ultimate team to distribute that out. And just so you all know, Ultimate has been a really consistent partner joining this collective action effort, always participating, always a really strong partner in the space. And so we are really hopeful that you all will be able to have that space as well.
Wow, thank you so much, Ray. And I do want to say before we end and open up for Q&A, if there is time, a big thank you to Great Public Schools Now for providing that support to conduct this survey. And I know there's more work that we have to do between us as well moving forward. So looking forward to that as well. And again, thank you to the My Community, My Health Coalition, our partners, and honestly, the team who worked behind the scenes to have this completed and done. So big thank you to those unsung heroes that we don't really see. Anything else to add, Rosa?
Yeah, I just want to say, so this report or these findings aren't actually going to be released until about mid-June. So consider y'all as like our first kind of presentation and the first look at this data. We will be sending out that report through to all the partners here, and we would love y'all's help in just like, elevating these findings as we try to disseminate them later on. So I'm sure we'll be in touch, but thank you so much. And oh yeah, if y'all have any questions, I don't know how much time we have, but I will hand it back to Alicia.
You're muted, Alicia.
Okay, sorry about that. What is going on? Sorry about that. During the break, we had IT come and help us with the technical issues we were having. So we are back to normal, hopefully, and we apologize to GPSN and to our civic engagement team for the difficulties. We will have an opportunity to showcase the report in our newsletter. So if I'm sorry again for not being able to listen and having the little transition issues, but we'll be able to highlight it there in our newsletter as well. And if you all want a copy of it, let us know and we can send that to you all. So thank you, Ana Teresa Dahan, Ray Lopez Chang, Cynthia Romo, and Rosa Vasquez. If you have any questions, we'll open it up for maybe 5 minutes as a thank you to you guys for presenting today. And if you're embarrassed to ask, put it on the chat and then we can forward it to the team and we can get answers for you all as well.
I guess my question is, are you guys using any or talking to any of the legislature people that can help push forward some of the advocacy that needs to happen? And if so, because I know we do a lot of that through our Twitter, where we send stuff that we want to get pushed, because we do a lot of after school programs. So we're always making sure that everybody in our organization is always sending tweets out like on a daily basis to make sure that these people understand the needs of our community. But if you guys have something like that, then I'm sure that almost everybody here can support with something like that. It's a tweet takes about 2 seconds to shoot out.
Yeah, so I think we definitely want to disseminate this far and wide, and that would be super helpful. We will probably be sending out, especially to partners for the coalition, a social media toolkit, which is like a one tweet, because we definitely want to do like a coordinated attempt to try to get, the attention of the folks who can really kind of make a difference here and who can fund initiatives. So I think that would be amazing. We'll definitely make sure to reach out to partners on how we can elevate through Twitter and stuff, because I think, the more the merrier at this point, and the more eyes we can get on these findings, the better.
Hi, my name is Brenda Lopez. I'm with Magnolia Public Schools. Thank you so much for this information. I just randomly stumbled upon this meeting from a friend who shared the invite. And so I was previously on a school site in the Sala community in the city of Bell, and I would do a lot of work. They would have monthly Sala meetings, obviously before school closures and all of this craziness this year. But I was just wondering, this is your second meeting. Did this coalition just start, or what's the, like, what's the ongoing, check-ins for these meetings?
Thank you for asking. That's a very great question. So we started the meeting with a video that highlights the work that we're doing. We have 4 quarterly meetings in a year. They take place every 3 months. And we also have 3 work groups that are dedicated, one to chronic disease prevention, the other one to youth empowerment, and our last group to environmental health. So what I'll do is maybe I'll send you some information on the coalition, and hopefully you can join us, because we need more advocates, especially in the youth empowerment work group, that can advocate for the students and the youth in our community.
Yes, I would love that. Thank you. I think I put my email like 4 times in the chat. So thank you so much. And I echo, I think it's Gerard who also said, we're looking forward to sharing these findings. So if you can just share this, either the slide deck or definitely an email, because sometimes when you do stumble upon, great groups or things like that, sometimes, unfortunately, a lot of it depends on funding and, like the groups sometimes, and so then they just disappear. So there's some, I've been a part of some groups in the SELA community where we're doing great work, and then all of a sudden we stop meeting because either the funds weren't there or something happened. So I hope that doesn't happen here. Thank you.
Thank you so much for your comment, and we'll go ahead and send you a copy of that as well. Any other questions before we move on to our next presentation? Perfect. Well, then we'll move on to our next presentation. We have the Ultimate Combat Initiative.